way and share a little bit more about what it is that I do, but also just a few lessons that I hope we can all learn about serving and being an older adult. So, oh no, you're fine. You're totally fine. I appreciated the introductions. Just a little bit more about myself. I am a nurse practitioner by trade, so I have worked for over 15 years taking care of people of all different ages, but mostly those 65 and older. And about 5 years ago, in August, I was able to move to a position at the University of Tennessee, Chattanooga, in their School of Nursing. And it allows me to do projects like this all the time. It's a really great job. I get to travel around and meet people and talk about things that are important in the community and how we can all support each other. So I'm a fan of supporting each other. One of the things that I always kind of start with is this definition of old. And everybody always looks at me kind of funny when I start talking about older adults. And you wonder, do I fall in this category? Or is she calling me old? So old to me as a practitioner is really just a date of birth. No matter who I see or who I come in contact during the day, it really doesn't matter to me what that birth date is. What matters to me is, are you happy? What is your quality of life? Are you able to move around and do the things that you want to do? Do you have family support or supportive friends or a great senior center like this? Those are the things that really matter. For medicines and research and all those things that we do to work on physical health, people will often categorize those who are older than age 65 as an older adult. And that's just so we can frame our information. In other words, how many older adults are in Madisonville? How many older adults are in the state of Tennessee? That's a different group than a middle-aged adult or a younger adult. My children, my 16-year-old would say that he is absolutely a young to middle-aged adult. He certainly knows more than I do, right? So really it's about being able to categorize things more so than the title and worrying about what age that means. So we know in the state of Tennessee that somewhere around 22% of us fall into that 65 and over category. As time goes on, that percentage is going to be higher and higher and higher. And so we need to all work together to make sure that we have all the structure in place so that we can all enjoy whatever age we are. That may look like for some communities having sidewalks or parks or churches who have programs to support older adults wherever they are, whether that be in the community or in perhaps an assisted living or nursing home. Gives us all tools if we prepare to make sure that we can all age successfully. And that's really the one thing we all have in common, because since we woke up this morning, we all got a day older, right? So that's where we're gonna go to with this presentation, and we're gonna talk a little bit about, make sure I'm going forward here. Oh. Okay. One of the things that I wanted to start with, and it's not always a great idea to start with something negative in your presentation, but I really think it helps frame some of my talk and then Reverend Black's talk as well. Tell me some of the things that you're afraid of. I'll tell you mine in a minute, but what are some things that you're afraid of?
I'm afraid of falling.
Falling?
Yeah.
Mm-hmm. Yes, ma'am?
I'm afraid of being in a complicated inner city and getting lost.
Getting lost, all right. Anybody else? Yes, ma'am?
Afraid of crossing bridges.
Crossing bridges. Yeah. Well, that's why I put that picture up there, because that's my number one fear. When I was young, I don't know, you all may remember, I grew up in Florida, and there's the big Sunshine Skyway Bridge that goes across from Tampa to St. Petersburg and then on south. And there was a bus accident. And I remember seeing that when I was young, and ever since then, bridges are not my favorite thing. I gotta get across them sometimes, right? And my kids always see if I'm white knuckling it. But those are my fear. So we all have these different, my son is afraid of spiders. My husband's afraid of snakes. We all have things that we don't love and that we're afraid of. Yeah, what's yours? Being alone. Boy, that's a big one. That's a big one. So as we think about our fears, think about the things that we use in our daily lives to kind of work against those fears. And for some of us, that falls into our spiritual life, into our faith in God or a religion or a community of people who support us. In Tennessee, over 86% of us report that we have some sort of spiritual connection to a church or a religious community. And by doing that, we frame our values and beliefs and things that we look for in other people and in life around our spiritual beliefs. So that allows us to do some projects around making sure that we're helping churches and other communities have the tools to serve our older adults. The other thing is a lot of our congregations are aging, our leadership, right? So present company excluded, some of our leadership is getting older. And so they're wondering, how am I going to pass along the things that I've learned and the things that I've done and my legacy? What are some ways that I can do that well? So the Tennessee Department of Health, about 2 years ago now, gave us some money to travel around and talk about some of the things that we deal with as older adults. The next one is stigma. And can anyone think of an example of stigma? Stigma is like a negative belief about something that's not true.
Old people can't move well.
Old people can't move well. Okay. Who else? Anything you can think of? Okay. Well, in some of the, if you look up in the dictionary, one of the examples it gives is something about divorce being bad, and so it's negative connotations without really knowing a full story, right? And a lot of times we frame problems people have with their health as negative or as scary. We're fearful. I'm going to talk a little bit about dementia today and about memory loss and about caregiving. And sometimes when we interact or try to interact with people who we know have some memory loss or who are taking care of someone, we're not real sure what to say. And we worry if somebody acts a little bit differently, especially in a church setting when we're supposed to be quiet and worship a certain way in a certain order. If we have to change up that order at all, it may this just doesn't feel right. So all of that is wrapped up in a little bit of stigma. And the way that I have a tool, the way that we work, is to help eradicate and get rid of some of that fear and stigma around memory loss and around caregiving. And so real quickly, we use our education and support as a way for us to provide and frame information so that knowledge is power. And when we know about things, it's a lot easier to understand them and to help each other, to help ourselves and to help other people. So a couple of those little statistics and then we'll move on. We know that memory loss affects usually 1 in 3 older adults. So again, in that age group, 65 and older, and then we know that it takes about 4 people to take care of someone over the course of their life once they start having memory loss. So if you think about a congregation of 100 people, and say 20 of those fall into that older adult or aging category, you have a significant number of people who may be having some memory loss. There's a church in Chattanooga where it's a church that's been established for many, many years. One of their older adult group Sunday school classes has over 125 people in it. There are at least 5 couples who a spouse is taking care of the other spouse, but no one else in their Sunday school class knows that they're having this problem. And the reason is because they're fearful of sharing their diagnosis, and they're afraid of the stigma of what people might think about them if they tell someone. And the church is meant to serve. The church is meant for all of us to come together and hold each other close and support each other. So being able to know about some of these things helps us do that well. It helps our leaders and our volunteers and us as members care for each other in the way that we believe God calls us to. So, a few things about memory. Memory is the ability to remember something. It sounds pretty basic, right? But there are a couple different stages of memory. So there's the memory, the long-term memory of where we grew up, where we were born, what our birthday is. There's the memory of what you had to eat yesterday. If you see me in a clinic, I might ask you, what did you have for breakfast yesterday? And that tells me a whole bunch of things. If you're able to tell me, it tells me about your memory, but it also tells me about your nutrition or your habits, whether you have access to food. But that's more of an intermediate memory. And then there's the memory of, what are we doing today? Or did the doorbell just ring? That real short-term memory that we have. When those memories start to fade or get more difficult during a daily basis, if we have trouble remembering if we took our medicine, if we brushed our teeth, if we're paid the bills that month, some of those things are just normal part of aging. But when our memory starts to really affect our ability to live as we normally do, pay bills, get groceries, get to where we're supposed to go, that's when we start to think a little bit about whether we should do some further looking, right? Because I lose my keys every day, trust me. I also lose my credit card. I lose a lot of things, and it really frustrates my husband. So the second part of this is our cognitive function. And you might hear these big words. Well, they have mild cognitive impairment. Well, what does that even mean? Does that mean they have a memory problem? Does it mean they have a problem solving puzzles? What does it mean? Cognitive function is more that ability to think through problems, to problem solve. So if you lost your keys, how would you go about finding them? Do you retrace your steps? Do you call a friend? You know, that process of thinking through how to solve a problem. We lose some of that with dementia. Our judgment tends to go bad, but some of that is normal aging. Judgment, you know, there are some men who might think they can climb a ladder to do some hedges or some roof work, and not so much. We end up with those falls, right? I call that poor judgment, right? But it happens. We don't think through the consequences. So when we have trouble remembering plus thinking plus reasoning what makes sense, that's when we start to pull all that together and think we may have a little bit more of a problem or an opportunity. I keep going backwards. Okay. You have a handout in front of you. So dementia is an overall term for memory loss, okay? And there are different kinds of dementia. So how many of you like bagels? I love a bagel. I haven't eaten one recently, but I love a bagel. So there are lots of different kinds of bagels, right? There's the everything bagel that has everything on it. There is the cinnamon bagel, the cheese bagel, all different kinds, but they're all bagels. Dementia is memory loss that is not normal part of aging that affects your daily activities. But there are different types. And so on this little, I'm gonna borrow your handout here, because I knew the screen would be small and that you may want to refer to this later on, you have this handout and it talks about the different kinds of dementia. Now, some people may say, well, I don't really want to know about dementia. I don't want to know if I have it. I don't know what kind it is. Why does it matter? It matters to me as a healthcare professional because I can help you and your family plan for the different symptoms that you might have or the different challenges. So, in our brain, let's start with the heart. How many of you know how to keep your heart healthy? What are some things that you would do to keep your heart healthy? One more time.
Exercise.
Exercise, that's right. Absolutely, exercise. What else?
A good diet.
A good diet, absolutely. Our brain functions a lot like our heart. So we call it, what's good for your heart is good for your brain. Our brain has a couple different functions. There's electricity that goes on, believe it or not. That's what helps it beat the way it should, our heart beat the way it should. There's also the plumbing. When you hear of someone having a heart attack, something has happened that has made one of those pipes that run around our heart with our blood either stop up and clog, or perhaps there's some bleeding or things like that that goes along. But the brain is the same way. There are different things that happen to the brain that cause an issue. And that's where we usually start to see things like stroke or memory loss. And it's something that has impacted the brain to make it change, and it shows in memory loss. So this picture's a little weird. It looks like a big tangle. So how many of you put up Christmas lights? I do, yeah. But how many of you do it well and put them up good each year when you put them up? If you don't, you get out a big tangle. And that's one thing to think about when you think about what the brain starts to do when we start to have these memory loss, yeah. So we see these tangles in the brain. The other thing is, if you've ever had or seen a string of pearls on your neck, yeah, just like these, the part of the neurons or the things in the brain that help communicate have these long strands of what you could call pearls. And when they break down, it's like you pulled the string and all the pearls go flying, okay? And so it doesn't keep everything together. That communication is broken because those pearls aren't in the string like they're supposed to be. These are things that we see happen with Alzheimer's disease. And a lot of people frame all memory loss under Alzheimer's disease. So it can be confusing, and that's okay. In the end, it's memory loss. But there are some other kinds of dementia or memory loss. One is called Lewy body dementia. Inside that piece where that neuron where there's communication, there's these little, we call them Lewy bodies. They're like little red cherries inside, and they disrupt all the communication that goes on in the brain. Lewy body dementia causes a lot of extra problems, challenges. It might look a lot like Parkinson's. You may have some tremor. You may have difficulty sleeping. You might have personality changes a little bit. You might move a little bit slower. You might fall a lot. Fall is one of the big things. So there's a difference in Alzheimer's disease versus Lewy body, because I know if somebody is diagnosed with Lewy body, they're going to need a lot more of a specific kind of care. So knowing that early helps me frame that, helps me say we may want to get rid of steps a little bit earlier. We may want to go ahead and do some of these home modifications because you may fall more often. So it's really just a very practical thing to know what kind it is, what kind of memory loss. on. Oh. So, now we get to the where. As we age, a lot of us are wearing glasses. We have difficulty with our vision. That's a certain part of the brain, right? That's responsible for our vision. Some of us may have more difficulty with our balance, and that's another part of the brain. So if we map the brain and the things that are going wrong with it, we often see that some of the damage, where those pearls have been shattered, or there's a Lewy body, it's that part of the brain that's being affected, right? So when we see some of the symptoms of memory loss, those could be being confused. They could mean having trouble with our balance. Again, personality, just being not as coordinated as we were before. But as these things get to a point where we need more help, that's when it's important that we have a lot of this plan. We'll talk a little bit about plan. Making sure that we've got things in place to help us. And this is a big job that the church can help with. These are big tools. Helping people get food if they need it, if they're no longer to get out of the house, or if they're alone, going by and playing a game, or having support groups for caregivers. Lots of different things that churches can do, a tangible something to help someone who has some memory loss issues. It's interesting that as people progress through their journey with memory loss, it's the opposite of when a child is born a lot of times. So think about when you're a baby, you have to learn to use a cup. You start with, nursing, and then maybe a bottle. Then you might go to some finger foods, or learning to eat with a fork or spoon, and then drinking from a cup. As we lose some of our brain's ability later in life, it almost works opposite. We start losing that ability to feed ourselves, and our ability to drink changes. And so knowing all these things, we know how we can help care for someone. So it's always interesting to think about that. Later on, you can think about that and think about how a child learns to crawl and then walk. And a lot of times we'll see that opposite happen. I wanted to bring up delirium for a minute because a lot of you are pastors or you're church members, and you may visit people who are in the hospital. The hospital is not a great place for any of us. We do our best to keep people out of the hospital. When people are in the hospital, it doesn't really matter what's for, but after a few days, our mind starts to play tricks on us. It doesn't happen to everyone, but it can happen. I don't know if any of you have visited someone who knows who you are, but after they've been there a couple days, all of a sudden they don't remember who you are, and they're not quite sure where they are. This is typically something called delirium. It could be other things, but delirium happens a lot because our brain needs to see daylight. Our brain needs to see the sun come up, the sun go down, the moon come up, in this routine, right? And when that routine gets wrecked, and if you've ever been in the hospital, I know you didn't get much sleep and there were lots of noises and things going on, but you certainly, most likely, didn't have that ability to see that change. Our brain starts to play tricks, and it can really be scary if you visit someone and all of a sudden, yesterday they knew who they were, they knew where they were, and now they don't. I want to encourage you by saying, more than likely, it probably has to do with something like delirium, where there's a confusion that's set in, and hopefully the sooner they get out of the hospital, that will tend to go away. Sometimes it can take months. Sometimes it just takes a day. But being able to recognize that's important, especially for all of you if you're visiting someone. The reason is, and one way to tell the difference is delirium happens like overnight. A dementia or memory loss usually takes some time. But if you visit somebody one day and the next day things are off, there's either an illness problem or perhaps something like delirium. And again, the main reason I bring that up is because we can help with that. We can help with flipping the blinds open when you go visit someone if there's a window, playing some music if they enjoy music, making sure people have their hearing aids or glasses. What's the first thing that happens if you go to a surgery or if you go in the hospital? What do they take away from you? Your glasses, your hearing aids, your dentures, all of those things, along with your wedding ring and everything else. We really want to be sure that we advocate for those who are in the hospital and for yourselves and make sure you have your glasses and your hearing aid, especially if there are people talking to you about your health care and decisions that you need to make. So you can help when you visit people by making sure, if you go see them and you know they wear glasses, that while you're there, they have their glasses to put on. It may be tucked away. Get it out for them. Let them use those glasses and those hearing aids. That's a big, big deal. So now we get to the point where everybody's thinking, is it going to happen to me? I have some struggle with my memory, but what is my risk? And really we know, again, what makes your heart healthy makes your brain healthy. There are some genes that we are born with that put us at a little bit higher risk. Some of you may have people in your family who've had memory loss. It doesn't mean necessarily that you will, but it may mean that you're just at a little bit higher risk. But there are other factors as well. You see football players who have been hit in the head a million times. I will tell you, soccer players get concussions a lot too. It's not just football players. But if you were an athlete and played basketball and had concussions, or if you fell frequently or had some sort of car accident, that may put you at a little higher risk. All of these things go into a bucket. And then we do all the things that we can control to take things out of that bucket, right? And then that comes up with your risk. And so while we do our best to try and pick out who's more at risk than others, what really matters is the things you can do to help take care of yourself now and those around you. So you may want to know, well, how do we diagnose a dementia or memory loss? And years ago, when I first started practice, the only way was after somebody died, and that was on autopsy, looking at their brain. We have a lot better tools now. We have some blood work that we can do. We have something called a lumbar puncture, where we take some fluid from the back. We've got some brain scans. I would say this, none of that's a lot of fun. But if you know someone or you are having some issues with your memory, it's important to talk about it with your provider, because it may be another problem. Many of us are on medications that may cause some of these signs and symptoms. Many of us have friends or family who are on 15, 20 different medications, and one little change can spur some of these symptoms. So it's really important to get an evaluation and talk to someone, to encourage your church members to see a healthcare provider to make sure there's not another problem going on. The thyroid can cause some issues, lots of different things. So it's important to talk to someone and make informed decisions about how far you want to go down that track, right? So it may be a medication issue and problem solved and we move on. It might not, and we might need a little bit more testing. The most important part about the diagnosis is allowing people to help, and for you to be able to make plans as well for how you see the end of your life, which may be 30 years from now. Dementia does not mean that you are assigned a time to live and how long it's going to be before you die. There are people who have had dementia for many, many, many years, and you don't know it because they've never told you. But they continue to work at their jobs, they continue to come to church, they continue to worship, but then they may start to struggle. And so when people bring you into that world and say, okay, I've had this diagnosis, this gives you a little bit more ability to rally around and support them. There are different stages. So someone in the early stage may just have some trouble with, getting around town or paying bills. And then there may be more middle stage where you're having more trouble sleeping and you can't really stay alone safely. And then of course there's the late stage. And some of the information that you've been given, she can come in front.
She
was
did.
a queen in Alice.
Oh.
Shoot.
Thank you for coming.
That's what I say, Artie.
I'm so glad you're here. Thank you for coming. It takes a minute, doesn't it? Yeah.
She does not like going up that step.
Yeah.
She's a star student.
Yeah.
You're a queen,
Yeah, over here. It was right here, Mr. Willie.
So there are lots of resources for whatever phase someone's in where you don't know the answer on how to help someone, we can get that answer for you. And there are different resources. A lot of the fear wrapped up with memory loss is that there's no great cure, right? We all remember cancers or have heard of people who have health problems that there's no cure for. And I think the hope that you have to have and the encouragement with a diagnosis is that we still don't know how long you have on this earth. We may pass away tomorrow from a sudden heart attack or a car accident. Dementia is not one of those things that has to stop your life and stop you from doing the things that you enjoy doing. And one of the ways, again, that helps with that is if we share information with each other and we rally around those who have these illnesses, because being alone is really awful. And being alone has some really bad connotations with it. And so any time that we can spend time with each other or help people get moved to maybe where their family are, make sure that they have support, or help people call on their faith in God, because we're never alone with God ever, right? We're never alone. So, but sometimes these physical challenges that we have, we forget. We forget our spirituality, we forget the love of God, we forget that we have someone higher, a higher power to call upon in those times. And our Bibles are a great resource for that, I'll tell you. They'll remind you of all the good verses. You also have another form here that tells you about resources if you or a family member or someone you know has a diagnosis of what to do next. It's really hard to receive that information and it gets very overwhelming. But there's a step-by-step guide of things that you can do and people that you can reach out to for help if you need it. So again, we talked about heart health, and we're going to wrap up with things you can do for yourself. Continue to try and eat healthy, exercise when you can, even if it's just arm lifts, sitting in a chair. Do something for movement. Make sure that you're socializing when you're able to, and do some brain activities. Maybe get some friends together for cards, or have some worship services where you sing and spend that time worshiping God, but also with your fellow church members as well. All of those things help. It also helps to take care of some of the legal stuff. Take that off your mind. Make sure that things are intact, and all of us can do that now, no matter what stage of life we're in. If you're 22 years old, you can start thinking about your wishes if you're not able to talk with somebody. And we have programs where we can have you bring whatever legal stuff you have, and an attorney can help sort through it for you. Doesn't have to cost a lot of money. An advanced care plan or advanced directive can be free. You don't have to spend a lot of money to do it, but it's really, really, really important to have it. Things we can do for others: we can raise awareness, kind of like we're doing today. Provide that education. Let people understand that it doesn't need to be a scary diagnosis. We don't need to have a stigma around it. And so you may say, well, you haven't told me how to interact with somebody with dementia. You haven't really explained all that. And I think it's true no matter what condition, physical, emotional, spiritual, it's the same approach. Be open and honest. Keep the lines of communication open. Be present and listen. A lot of times we don't have to say a word at all. I had a pastor call me a couple months ago, and he was headed out to help a spouse who she said her husband just wouldn't calm down. He was real anxious and upset. And the pastor said, I don't know what to do. What do I do when I get there? And first, it's just listen. Just listen. Be there and be present. And then there are some other tools, but be a part of the solution and provide that encouragement as well. There are some organizations who have put together full toolkits and programs for helping create a dementia-friendly church, a faith community that's dementia-friendly. We have some of that information. It's all over the internet. Reverend Black has far and above already started those initiatives here in Madisonville. So he's a good resource as well. The Alzheimer's Association has a lot of resources also, including a 24-hour hotline. And then lastly, we have our grant initiative, which provides programs on all sorts of topics. Elder abuse, scam, fraud, doing your advanced care plan, legal issues. We have the ability to come to your church and provide whatever kind of program you would like. And if you don't know what that looks like or what that should be, we can help you figure that out too. And all of our programs are free of charge. And you should each have some information there, but our contact information is around, and also Jennifer and Dr. Levin have it as well. Does anyone have any questions at all? Happy to take them. Anything I didn't cover?
How do you get a diagnosis of dementia if you think someone has it?
How to get it? So it starts with seeing a healthcare provider. Now, there are a lot of different providers that can give information or even do some of the memory testing that sometimes goes along with it. Social workers are trained. If you have a question or having difficulty finding where to go, a pharmacist can often help, or a pastor, a reverend, or chaplain. But it doesn't have to be a doctor or a nurse practitioner to provide that diagnosis. Now, if you want to get into what type and what kind, it generally takes some extra testing, and so then you kind of have to get into that health professional field to see what kind. But we can pretty much tell from memory testing that can be done if there's an issue. It's really very interesting.
Where do you do the memory testing?
We could do it on the street, we can do it in a home, we can do it anywhere, in an office, hospital. The memory testing, there's a screening that's really just 3 questions, but there are some more in-depth tests. So say somebody is 40 years old and they're having some issues with memory loss, but also some other things, and we just can't figure out what's going on. You can do a battery of tests through a psychologist that will help tease that out. And I always stay amazed. I don't know if you can see this, but if you can, the clock on the right is one way that is really helpful for us to tell if there are some memory issues. And a lot of times we'll start and we'll have people do a clock when there are no memory issues at all, and then every year we have them continue to draw the clock so we can see if there's a change. But being able to draw the clock and put all the numbers in the correct place and do the hands the correct way with the correct time is very telling. So there are lots of things that we can do without x-rays or blood tests or things like that. And the important part about that is we can get resources going. We can get resources to a person. If a person does not want to go to the doctor, but we know that there's some sort of memory issues going on, we can go ahead and get some community support going without that formal diagnosis. Does that make sense?
Yes, it does. So if you have a CT scan and you've got an MRI and those are all clear, but you still think something's going on.
You have to keep investigating. You have to follow your gut. Keep investigating. Do you want to speak to that?
Let's say, we're really lucky here in Monroe County because recently, Glen Senior Cares now has 2 gerontologists who are available in Von Orr, and actually one of them, I believe, is going to speak here at the Senior Center on how to do that testing. So we now have that testing available in the community. The Pat Summitt Foundation clinic at UT has a 1-year waiting list, which is just so crazy. And, Genesis, is that it? Has about the same length of time. So it's really good that we're getting some, I always love it when they come to us, so, I cannot think of this gentleman's name, I can see his face, but that's because I'm an aging person. And, but that is there. The thing that is, you need to know is that while the testing is important, I've seen people who have absolutely horrible, actually it's, what do you call it, scans that you need for the tangles, it's not.
PET scans.
Yeah, it's PET scan, thank you. You have to have a PET scan to really do it, which are very somewhat rare. But even I've seen people who have terrible PET scans, who it's all about function. Everybody, how this tangle in the head affects an individual's psychological function different, just like every other aspect of our physical. Some persons respond really, really badly to diabetes, other people just scoot along and have no real issues with it, so.
Without a diagnosis, can you give the medicine?
That's one of this is one of these gray areas, and a lot of times you do it to see how it does. A person who's got forgetfulness, and we put them on one of the different medications and see if there's a change, and we just know, that's the way it's sort of a, by example, evidence-based, not evidence-based as much as just
Trial and error.
Yeah, trial and error experientially, so I think that's really important. But I think that those are all really, really good questions.
Any other questions?
What is the youngest age that you've encountered someone with dementia?
The youngest age of someone that I've encountered. I had someone who was diagnosed in their late 30s. However, they had some other issues as well. We're seeing diagnosis earlier and earlier in age, but I think a lot of that comes from the increase in awareness. So people can be diagnosed 30s, 40s. It really takes being a private investigator, because you wouldn't expect it, but it does happen. But personally, I have had someone in their late 30s, early 40s.
Is it better to get them on the medications early then?
Medications are one of those things that you really have to talk about and think through. You want to look at what the purpose of the medication is, what you're hoping to solve. More and more, we're seeing medications come out that are meant for people with early dementia, right? And they come in different forms. And you have to think about what you're trying to accomplish versus the risks and benefits of doing it, of taking it. And then it's going to be different for everybody. And a lot of that is practical stuff. It's how you get the medicine. Is it IV versus in the mouth? Is it something that costs a lot of money versus not? We will use medications sometimes for some of the symptoms. So if there's a personality change, we'll use other medications that might help with that, but they don't necessarily, they're not marketed for memory loss, if that makes sense. Sleep medicines, things like that. But by and large, we're getting better and better at knowing how to provide support without medications. Different things that we can do with behaviors and habits and supervision and things like that. And that's really why we're doing most of this community support, is because we know that people can stay in their home longer when we're able to provide a lot of resources other than medication. But it's something you really just have to discuss and look at, and it's for certain types too, so you have to meet certain criteria.
And one of the problems that we've got that it's just so counterintuitive that it has to be talked about is one of the things we can do the best for older people is take them off of medicines. Most people come in with what I call polypharmacy. There's 6, 8, 10, 12 drugs. And as we start taking the medications away and getting down to the one they need for their blood pressure and the one they might need for their diabetes, they get more and more able to function mentally. There are just so many sidecars on these little side effects on all these medicines. And that's so hard for the person who's always used that medicine to sleep. But now, all of a sudden, maybe they just need some chamomile tea at night or something that doesn't have that 24-hour half-life. That's the word that kills you. That's the way the drug, how long the drug stays in your system. It's that half-life and such.
I will stop now, but I will be here. So if you have questions, come see me. But we'll let Reverend Black get on with what he's going to tell us, which is going to be far more encouraging, I'm sure.